But you also have a substantial amount of lean body mass. I think you even posted a DEXA on Instagram not too long ago.
Just to
I see
flex on
I see a
people.
lot of
should have
health
posted my in body though.
Oh, an in-body.
Go
Yeah.
ahead.
I see a lot of health influencers that talk a lot about lean body mass, but never post any DEXAs. All right. So I guess we can hop into some of your labs. So this is the trough of your health from the last 3 years.
Yep.
LDL. So actually we have the lipid panel here.
This is off my meds too.
Total cholesterol 174, triglycerides 79,
Higher.
HDL 41, VLDLs 15, LDL 118, and ApoB I'll just mention was 96.
96. Terrible.
So how do you feel about this lipid panel? This is your natty lipid panel.
I feel like I'm dying. I'm starting my ezetimibe. Mostly because of the ApoB. The HDL, I think a lot of it is due to my less exercise in recent weeks since the Hypercon games. And the LDL is actually a lot better than I thought. The ApoB is about what I thought, but it's because I've been consuming large amounts of sugar and carbs. And usually I do eat pretty medium to low carb, especially for, when I eat my carbs, I usually eat my carbs before and after exercise, but I just kind of kept doing that. And then I didn't exercise as much. So I'm going to hop on my ezetimibe again. And with my Achilles tendonitis, that is almost all the way better. I think I've been off my every other night 5 mgs rosuvastatin for almost 6 months now. And my lipids have looked pretty good. And I don't think that the rosuvastatin is what caused my left-sided Achilles tendonitis. But as I'm rehabbing it, I kind of just don't want that to be a compounding variable.
Yeah, I think that's fair, as long as you don't let the 6 months sort of spill into rehabbing your Achilles for the next 6 years or 6 decades.
Yeah, it's true. And here in the next 5 years or so, when I get my first CCTA with plaque analysis and whatever else is needed, that'll certainly be a more important decision tree point. But for many years, I've tolerated my rosuvastatin well. I suppose the other reason why I was off it is I was conceiving a child. I was on a fertility phase, which perhaps I'll go into later, or maybe I'll convince the wife to do a podcast, which would be pretty interesting at some point.
Yeah.
No promises for that.
Yeah. So you think I don't know if you explicitly mentioned, but you think the increased sugar intake contributed to the higher triglycerides, but also contributed to the lower LDL.
Yes. Yeah. It wasn't Oreos. It might have been a Butterfinger here or there in a Ninja Creamy, but yeah, it did.
Gotcha. And then let's see. I don't know if we want to bounce back and forth lipids to lipids, or just go straight down through your results. How do we want to format it?
Whichever. I will say, in regards to my lipids and the carbs, like being seen in a good way, I would actually rather have my insulin be 3 or 2, which it usually is. My insulin was 6 something, which is horrible for me. And I can just tell that my insulin resistance is starting to build up. Even from a cardiovascular health standpoint, I would rather my lipids be slightly worse and my insulin be better. So I'd rather my insulin be 3 and my lipids be a bit worse than my insulin be 6.5 or 7 and my lipids be better. So the carbs were not worth it to lower lipids. However, why not both? I'd rather have both and just take ezetimibe and have my lipids be good and have my insulin be good too.
Yeah, I'm also a proponent of technology, of which pharmaceuticals are a form of technology. So next we have
if you're anti-drug, if you're anti-medication, you're anti-technology.
Yeah.
You're basically Amish. Go ahead.
Your kidney function, what's going on there? Your eGFR is dangerously close to kidney disease. Creatinine 1.35, BUN 23. Glucose nice and low though. that insulin is still working.
Yeah. I guess I just have borderline chronic kidney disease, stage 3B, CKD 3B. It's a bummer.
No,
I wasn't even taking that much creatine at the time
yeah, and
or working out.
I actually haven't seen the creatine contribute to the creatinine. I hear that claim made a lot, but I've had patients where they weren't supplementing it. They start supplementing it. Doesn't seem to move the needle that much. I suppose it's dose dependent and probably depends on the person as well. But you also have a substantial amount of lean body mass. I think you even posted a DEXA on Instagram not too long ago.
Just to
I see,
flex on
I see a
people.
lot of
should have
health
posted my in body though.
oh, an in body.
Go
Yeah,
ahead.
I see a lot of health influencers that talk a lot about lean body mass, but never post any DEXAs. What's up with that?
It's like
They don't want to show the
pics
receipts,
or it didn't happen.
Yeah.
That's funny. So yeah, if you're an influencer that talks about the benefits of exercise, protein, and lean body mass, post your lean body mass. If your lean muscle mass plus your pounds of dry bone don't add up to 200, then what's the saying? I forget the saying as I'm saying it. Then you're not a influencer.
Yeah,
It's like if you're lifting
figure out
weights,
a jingle for that.
if you're lifting weights and you complain about someone grunting or dropping the weights, unless you can lift more than them, you cannot complain.
Yeah, I've heard people speak to this effect. Someone was talking about, oh yes, this was Dr. Peter Attia. Someone was pointing out, like, I don't know how you can use AirPods because of the EMFs or this and that. And he's like, I wish people would just do 50 push-ups before they would comment something like that.
Because
It's more important to be able to do 50 push-ups than to worry about EMFs.
I guess you could say, what does that have to do with anything? Why not both? Why not just drink a glass of water before they comment that? It's more important to do that too.
To be hydrated.
Yeah.
Make sure you're hydrated, optimally slept, your lipids are in order, and then you get your commenting privileges.
A random commenter, you should not put too much stock in any random commenter. Now, there's comments that are great, and a lot of times we read comments on these videos and posts, and we think, man, that is a fantastic idea, like the one about our studio setup.
Yeah, that was
and
good.
then you also read comments, and it reminds you that whether it's nature or nurture, there are certainly some humans which are better and worse critical thinkers.
That's fair. Now, for what we thought might be the most exciting part of the podcast, but turned out to be pretty anticlimactic, your HSV results. So HSV1, HSV2, stone cold negative.
False negative, 10% chance, right?
Yeah. So there's
at least a 10% chance that these are false
a
negatives.
90% chance that you are in the 10 or 15% that does not have a positive HSV1.
Yeah. And that I know of, I mean, most people are positive. So, only like you mentioned, depending on what area of the world you live in, you would expect about a 90% positivity rate for at least HSV1, but if not both, if not HSV2, causing a false positive HSV1. But anyway, I was pretty surprised to see that these are negatives. I suppose if I was a female, I would be concerned for contracting a primary infection during pregnancy. So if I was a female and I was pregnant, I would be worried about getting my first infection of this. It'd be much more severe, potentially life-threatening to the fetus.
Yeah. Now, you've never experienced like a cold sore, like a fever, blister, nothing like that?
Not that I know of, but most people haven't, even that test positive for HSV1.
I was going to say that's my circumstances, that I can't recall ever getting a cold sore, fever, blister. But I am positive for the HSV1, even though I've never had a outbreak that I remember. Maybe I was a kid and I just don't remember.
Yeah. Like we talked about on the HSV podcast, which is one of our most recently posted ones. Most people get this by the time they're age 5 from, kissing grandma or whatnot. But Gillettes are notorious for being germaphobes. Unfortunately, those were negative.
Homocysteine, 18.7. This must be because of your MTHFR mutation.
I am I believe a compound heterozygote, I think.
I think
You probably
that's
know
what
better
you
than
are.
me.
I should have
It's
pulled your
two
chart
of the main
to look and
4.
see.
Yeah,
But yeah, I am also you're either a homozygous recessive at the minor gene pair or compound heterozygote. I know that
correct.
I'm a compound heterozygote.
Yeah.
So homocysteine of 18.7. And previously, this has been very close to 10 in your case.
Yeah.
So that would be like an 80% increase with slightly less exercise, slightly more sugar. It doesn't seem likely to me that this is true. We also, unfortunately, don't have an APTT to sort of fact check that this blood didn't sit out for a prolonged period of time or hemolyze.
Yeah, I wouldn't be shocked if this was kind of like a slightly false positive homocysteine. But I was a little surprised. Maybe it sat out for a bit. Like you mentioned, there was no APTT. But I was consuming a little bit less creatine than normal. That's one thing that usually helps keep it down. So, yeah, I'm not going to put too much stock into it other than I'm going to hop back on my 7.5 grams of creatine per day. Maybe I'll take I usually don't even take a multivitamin when my diet's better, but I wouldn't be opposed to getting a little bit of methylated Bs in a multi, but I'm not going to take an expensive methylated B supplement or whatnot. And like we mentioned before, MTHFR only correlates with homocysteine about 10% of the time. So I'll get that down below 12. You don't worry about that.
All right. And then we have the insulin, of course, we referenced was 6.4.
Right.
And then the CK, which is good evidence that you were not exercising, because
Correct.
people that know you and know of you probably know how much you enjoy exercise and how intense you tend to exercise. I think you've had a CK that was
Near
closer
1,000.
to 1,000 last time, if I remember right. Definitely
Yeah.
above 600. It was
Yeah,
flagged.
my baseline CKs, and I think the LabCorp range flags above 400. But yeah, my CK, it would not be unusual if it's near 1,000. That's kind of what it's expected. It's 318 this time, and that is a sign that I have been really taking it easy, not breaking down a whole lot of muscle, and probably not synthesizing a whole lot of muscle either.
Oh, you should get an in-body to verify that.
My in-body will probably tell me that I am jacked and shredded.